Dr. Sofer Weiss, who's going to talk to us about hair loss, stress, and inflammation.
Good afternoon, everyone. We're going to be talking about stress and inflammation and how that affects hair loss, especially in women. I have no conflict of interest. This is a review of 256 articles as well as 73 articles authored by myself. A lot of references, of course, and my books, four books that have been translated in 12 different languages. What causes hair loss? A lot of different things. Genetics, autoimmune disorders, hormonal imbalance, thyroid conditioning, nutrients, all kinds of different aspects. Basically, the message that I would like to offer today is that hair loss is a systemic problem. It's an increased systemic energy is basically hair loss. And inflammation is the core of it, it's the center of this. So you have a lot of inflammatory disorders like autoimmune disorders, lupus, androgenetic alopecia, and so on and so forth. You have the Sjogren's hair loss, which is dryness and scarring alopecia. I guess that has to do with inflammatory processes, follicular inflammation that basically affects the follicles, and inflammatory diseases of hair follicles that are immune mediated, basically release of pro-inflammatory cytokines and chronic scalp inflammatory blood supply that it restricts it. So you have lymphocytes, you have histocytes, inflammatory genes, which is the GAS7 and TNF and other genes, of course. This is an article that discusses that. And again, there's a lot of articles. I found several articles on hair loss and inflammation. So inflammation is what aging. That's why older people lose their hair, because inflammation increases with aging. And you have the trauma-based scarring and hair loss. And you have basically a lot of trauma-based therapies. There is some kind of contraindications or some kind of problems with it, which is longitudinal studies. We don't have enough longitudinal studies to see what happens after. We don't have sufficient numbers of clinical studies and standardized protocols. I will give you a little bit of how to evaluate published studies. First of all, if the journals are mentioning the device name, that's a paid article. Basically, the author has paid the journal. So you have to be careful about that. You need to look for statistical significance. Sometimes they report a very high statistical significance, but when you look at their sample and the results, that significance does not basically reveal itself. You need to look for long-term studies, follow-up studies for effectiveness, whether the results are long-lasting or it's more temporary and then the hair starts falling again, adverse reactions and side effects. And you also need to look for conflicts of interest, if basically the study is paid by a company that produces certain devices. Now, animal studies, there's a lot of animal studies, and a lot of this research is based on animal studies, but you need to consider that animals have a synchronized pattern of hair loss, whereas humans have a mosaic pattern of hair loss. They lose sort of like a mosaic pattern, and they have different androgen responses. So they're not really often compatible. When you look at excellent results in an animal study, does not mean that's going to transfer to humans. And a lot of research has shown that up to 95% of what's safe and effective for animals does not basically translate to humans. This is a book that I wrote, that's one of my books, the Brainwashed book, that shows that basically marketing and truth are often incompatible, and you have to look and analyze the studies before we get the result. Now, we have a lot of treatments. Of course, laser treatment is a very popular one, and they gently stimulate the follicles with light energy. There are some common problems like scalp sensitivity and irritation. There is some temporary hair shedding, headaches, eye injury risk, and other effects. However, of course, lasers are extremely effective for hair removal, and there's a lot of studies that support that. And then you have radio frequency, and that starts at 3 gigahertz and all the way to 300 gigahertz. And and then you have the similar results like scalp redness and sensitivity. You have some very rare possible effects, long-term effects like infections, burns, and scars. And there are contraindications. People with active infections or eczema should not be taking this radio frequency treatment. And again, 15 out of 19 studies that I looked at, they look radio frequency for hair removal very, very successfully. And of course, you have antibiotics, the doxycycline, the other first speaker spoke about it, and you have the PRP, which sometimes inhibits inflammatory cytokines. However, it's more topical, the effect, so it's rather local rather than systemic. And the PPRP promotes anti-inflammatory. However, the LPRP might have greater pro-inflammatory responses. And you have the autologous stem cells, the mesenchymal stem cells. The problem with mesenchymal stem cells is that the donor's age matters. So if it's autologous and not old, then it's your own stem cells, and you have the same problem basically. And then you have undifferentiated human, animal, embryonic stem cells that have the potential of growing into tumors. They're wonderful, but they might not differentiate, and then they become problematic because of lymphomas. Then you have allogeneic and xenogenic immunorejection. In other words, if it's not your own, your immune system will reject it or might reject it, and then you're not going to have an effect, or you're going to have a problematic effect. And of course, exosomes have the exact same problems, that if they're allogenic, again, there's going to be the age of the donor, the age of the person is going to have an effect. And if they're non-autologous, allogenic or xenogenic, then we're going to have the immunorejection or other foreign allergies. Now the problem is, what happens when hair loss is due to inflammation, which is a systemic problem? And this is what we have to pay attention to. What is the, like for example, diet, which is, poor diet, zinc, B12, biotin deficiency, are also related to hair loss. And metabolism, that's a big one, because metabolism promotes healthy hair growth. So if you have metabolic problems, especially with age, that's going to be an issue. So our metabolism has a direct relationship, not only with our metabolism, but with all the production of all the hormones. And then we're getting into basically a hormonal imbalance situation, which is very prominent in menopause and in andropause. That is basically the core of menopause and andropause. And menopause and andropause affects 20 to 60% of women and men before the age of 60. And as you can see, you have the midlife crisis, where the guy goes out and buys a great car or gets a girlfriend, and there is divorce and separation. And basically, you have the hormones that are related to that is DHEA, that basically is connected to testosterone, progesterone, and the DHT. And DHEA decline will speed up aging and, of course, hair loss. And DHEA starts declining at the age of 25, and then it steadily declines after that. So the hormonal problem is very, very important. So you have high cortisol, that is a problem. You have the cortisol affects the follicle, the follicles are inhibited, and you have the hair loss, and then you have the trichotillomania, which is associated basically with high cortisol, but not just high cortisol, also psychological stress that is also associated with hormonal imbalance and high cortisol. And you have psoriasis and hair loss, like you have to be very careful. You cannot use radio frequency with this particular disorder. And now, another very important aspect is that the cell clog. Psoriasis is related to a disorder of the clog of the cell. So, and that's the Nobel Prize of Physiology and Medicine 2017. And again, all those are related to the hair loss. So the timing within the cell is affecting not just hair loss, but psoriasis that will eventually affect hair loss, and also is not going to be treatable by most current radiofrequency and laser procedures. And then you have the SRET resonance, which is the resonance energy transfer that started in 1950. And what it is, it's basically, it spreads signaling to kind of rebalance the system. And by rebalancing the system, you're optimizing the hormones. And that is the signaling resonance energy transfer. Sort of, the resonance amplifies. So when you have two signals, as you can see here, you can see that there is a difference. There is a response through the resonance. There is kind of a transformation of the cell through the resonance process. And what you see under the microscope, you see how cells can start the resonance communicating, and that's in real life under the microscope, and how that can basically help with the hair growth process, because it can revitalize the entire scalp. What is resonance? Is basically when two signals are compatible, they can amplify each other. If they're incompatible, they cancel each other out. So it's a sort of a chain reaction within the nervous system that can spread and affect throughout the system. And you can see it with very, very high powerful microscopes, like this microscope on the left here. And basically, the way you create is you basically take signals and you have clusters of signals, and then you sort of send the signal back into the scalp to revitalize the area. That's another treatment that has no side effects and is extremely comfortable. So we conducted a series of clinical studies with SRET, 6 treatments over a period, and this is the article that has been published. It's a couple of articles that were published very recently, specific on this, and I can show you the before and after of alopecia with this patient. This is from Malaysia, a study conducted in Malaysia, and this is a study conducted in Hong Kong, 4 treatments after 3 months. Hair loss basically can be reversed by refolding the natural proteins. And resonance does just that. Basically, it refolds the proteins that have been unfolded, which if they are unfolded, then they cannot basically function. This is again under the microscope. You can see how there is a growth through the resonance process. There is a lot of articles on that. There's thousands of articles you can find on the internet. There are several scientists that have successfully refolded proteins through resonance. The proteins are basically at the brains of the cell. If the proteins are dead and the cell appears comatose, as if it doesn't exist. There's a measurement test that looks at protein aggregation, a negative SCB, and a positive one. Basically, when the aggregation decreases. Aggregation means the proteins do not function, your cells are not functioning. So basically the conclusion of this presentation today is that hair loss is a systemic problem. So you cannot just look at it at the topical. You have to look at this as a systemic issue. And with this, I would like to end this presentation. And thank you very much. This is my WhatsApp. If you would like to ask any questions, please feel free to answer questions or email me. Thank you.
Thank you very much. Thank you very much. Now we're going to have Dr. Gonzalez Diaz. What type of alopecia is this one? Can we just sound help?